patients who have HER2 positive breast cancer, and HER2 is HER2 positive breast cancer is only seen in 15% of breast cancer or 10%, and HER2 is a protein on the surface of the cancer cells, and then that protein is embedded, and that makes the cancer cells grow faster, and Herceptin blocks that protein. And one of the ways the cancer cells develop resistance to Herceptin is that the cancer cells develop a property of losing this what we call extracellular domain of Herceptin. Now, we know that, but there is no drug we can give beyond that. So, there are other drugs such as TDM1 and things which have come along, but even if I did a biopsy and proved that, so there are two things. First is to understand why is someone's cancer getting resistant, and secondly, can we do something about it? So, the answer is there is a lot of research that has been done in why is someone's cancer changing, but in most cases in breast cancer that does not lead to a change in treatment based on the information you gather. Does that make sense? So, like in lung cancer, so I treat lung cancer as well. We have a very specific type of lung cancer which is seen in 4% of non-smokers, mainly non-smoker. It is only seen in 4% of lung cancer, and that cancer cell has a particular type of mutation called as EGFR mutation on its surface, and then there is a drug which specifically blocks that. In 50% of patients, the way the cancer cell develops resistance is it develops a second mutation in that gene which causes it to develop resistance to the drug. We knew that information from 4 years, but nothing could be done. But nowadays we have a drug that if you do that test and you prove that it is that mutation, you can change patient's treatment, and that is what we are doing now, and it has started in Australia as of July. That sort of a thing that you could do a test and change the treatment does not apply in most breast cancer patients, but I think we are coming to that phase, and probably in the next few years we will be there. And there is a lot of work being done in not just doing the biopsy, that you could do it from a peripheral blood sample. So, that lung cancer example I was giving you, so the cancer cells as they float around in the blood, some of them will die off, and their DNA actually floats around in the blood, and through a blood sample which is what we call as liquid biopsy, you can check some of these changes. And there is a lot of work that has been done with soluble Herceptin receptor, estrogen receptor and things in the blood, in the tissue, that you can do that. But like I said, in a lot of times that does not lead to a meaningful change. Like, it is good for me to tell you that your cancer has changed, but I could see that on the scan that the cancer has become resistant, but the test does not tell me what the next treatment I should put you on.